I'd like to call the House Health Committee to order. Will the clerk please open the board so we can take the roll? Get Susan to log in. Leatherwood, log in. Williams needs to log in too. Williams log in. There you go. There you go. We good? All right, clerk, you take the roll.
Mr. Chairman, you have 60 members present. You have a quorum.
All right, thank you. And before we get started, do we have any members with any personal orders? Okay, I believe we have a doctor of the day, Laura Andreessen from Franklin, who is an OBGYN. So thank you for joining us. All righty, and we have a calendar today. And before we get on the calendar, we have some housekeeping. Item number 3, House Bill 387. Has been rolled to the special calendar without objection. That brings us back to item number 1, House Bill 1492. Representative Slater, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman and committee. I bring to you House Bill 1492 today. Activated P13K Delta syndrome, which can be abbreviated as APDS, is a rare, complex primary immunodeficiency. APDS is a case of an overactive pathway that leaves the body less capable of fighting off infections. APDS can look common at first, but the underlying genetic cause is exceptionally rare and requires genetic testing to diagnose accurately. Individuals with APDS may suffer from a wide variety of symptoms, the most common being frequent and severe infection of the ears, sinuses, and upper and lower respiratory tracts. The intent of House Bill 1492 is to raise awareness for activated P13K Delta syndrome and to bring attention to Tennesseans suffering from this disease. And we would like to make October 1st of each year APDS Awareness Day. With that explanation, I stand ready to answer questions.
All right, thank you for that explanation. Do we have any questions for the sponsor of the bill? All right, seeing none, will the clerk please open the board for the vote? All those in favor vote aye, opposed vote no. Does any member wish to change their vote? Clerk, will you please take the vote?
Mr. Chairman, you have 18 ayes and 0 nays.
All right, House Bill 1492 passes and moves on to calendar and rules. Thank you.
Thank you, Chairman. Thank you, committee.
All right, that brings us to item number 2, House Bill 1528. Without objection, we're going to, he's got a conflict right now in another committee. We're going to roll that to the heel of the calendar. That brings us to item number 4, House Bill 1844, and we will also roll that to the heel of the calendar without objection. That brings us to item number 5, House Bill 1443. Representative Jones, you have a motion, a second. You are recognized.
Thank you, Mr. Chairman. So this is a bill called the Caregiving for Caregivers Act, and it will establish a pilot program to provide grants to family caregivers of eligible family members with Alzheimer's disease or related dementia. Currently in Tennessee, we have 129,200 people aged 65 and above who are living with Alzheimer's or related dementia. It is estimated that 386,000 family members and friends serve as unpaid caregivers and provide more than 675 million hours of unpaid care a year. So this program would provide a grant to be administered in each of the grand subdivisions for $600,000. And it would be, $6,000, sorry, a grant for $6,000, total 600,000. And it would be, because we know that caregivers lose around $36,000 in annual income. So this bill would help them pay for expenses, related expenses to caring for their caregiver.
I have I jumped ahead of myself. We have an amendment.
Oh, sorry.
I
Yes,
believe
sir.
drafting code 012946. Is
That's
that correct?
correct.
Need a
Yes, sir.
motion? Motion is second. Okay. We're going to vote on that. All those in favor say aye. Opposed, ayes have it. Now we're back on the bill as amended, and I believe we had a question. Chairman Hicks, we're on the bill.
Yeah, on the bill. Thank you, Mr. Chairman, and Representative Jones, thank you. I know you filed this bill last year, and it got utilized just in a little bit different way than what you planned, but I appreciate you bringing it back. Certainly, I look forward to sponsoring this. I know you've been working on it for actually 2 years now.
Yes,
So
sir.
thank you again for bringing it forward, and I certainly look forward to supporting this bill. Thank you.
Thank you. I appreciate it.
All right. With that fiscal note, that's
Yeah, well, okay.
strong support
I
there.
adjusted that a little bit. No.
All right. All right. Thank you. Any further questions for the sponsor of the bill? All right. Seeing none, will the clerk please open up the roll? All those in favor vote aye. Opposed, vote no. Will the clerk please take the vote?
Mr. Chairman, you have 20 ayes and 0 nays.
All right. House Bill 1444 passes and moves, 1443 passes and moves on to government operations.
Thank you, Chairman and committee.
All right, thank you. Okay, that brings us to item number 6, House Bill 1663 by Representative Mayberry. You have a motion and a second. You are recognized. I don't see any amendments.
That's correct. Thank you, Mr. Chairman. House Bill 1663 allows family child care homes certified by the U.S. Department of Defense to operate without duplicative state licensure when serving eligibility military patrons. The bill relies on the current federal statutes to provide oversight. I stand ready for questions.
All right, do we have any questions for the sponsor of the bill? All right, seeing none, will the clerk please open the board for the vote? All those in favor of House Bill 1663, moving on to calendar rules, vote aye. Opposed, vote no. Will the clerk please take the vote?
Mr. Chairman, you have 19 ayes and 0 nays.
All right, House Bill 1663 passes and moves on to calendar and rules.
Thank you, Chairman and Committee.
Okay, that brings us back to item number 2, and I think our 2 sponsors are still conflicted in another committee, so without objection. Oh. Chairman Clemens, you recognized.
Hey, Mr. Chairman, I move to adjourn.
Second.
There's nobody here to do business.
We can recess.
That's not the motion.
It's not the motion, yeah.
There's a motion on the table.
What? Your motion's tabled?
The motion's on the
On
table.
the
table.
table, we got to vote.
Okay, let's vote. Aye votes to recess, vote no,
No, it's to adjourn.
adjourn. Aye votes to adjourn. No is we're not adjourning. Open the board.
Nobody here to do business.
Okay. Will the clerk take the vote?
Mr. Chairman, you have 6 ayes, 15 nays.
We are not going to adjourn. We will take a 2-minute recess without objection. We are back in session. That brings us to item number 2, House Bill 1528 by Chairman Bolso. You are recognized.
Motion.
You have a motion and a second.
Second.
Thank you, Mr. Chairman. Good afternoon, members of the committee.
I believe we have an amendment.
Yes, we do, Mr. Chairman. It's drafting code 012833.
012833. Have a motion and a second. All right, let's get this in proper form. All those in favor say aye. Aye. Opposed? Ayes have it. We're on the bill as amended. You're recognized.
Thank you, Mr. Chairman. Members, this bill does one thing. It extends from 2 years to 3 years the period before which a presumption will arise that a surviving spouse in a wrongful death action has willfully withdrawn from the marriage. And let me just take a second to explain what exactly that means. Under current law, if a spouse is killed tortiously by someone, there's a cause of action that adheres in the surviving spouse to bring the claim for wrongful death and to receive the portion of proceeds that the statute specifies. That's true even if the parties are legally separated. As long as you're married, then as a surviving spouse, you're able to recover the proceeds of a wrongful death action. But if the spouses at the time of the death of one of the spouses are living apart, and they've been living apart for 2 years, a presumption arises that the surviving spouse has, quote, willfully withdrawn from the marriage, and that spouse is presumed not to be able to bring the cause of action on behalf of the deceased spouse or to participate in any wrongful death recovery. This situation occurs most frequently where there are stepchildren involved, and for some reason, the children of the deceased spouse want to try to cut out the surviving spouse, their stepmother or stepfather, from being able to participate in the bringing and the participation and recovery of a wrongful death action. And that, Mr. Chairman, is a brief summary of the bill.
Okay. Do we have questions for the sponsor of the bill? Okay. Chairman Kumar.
Thank you, Mr. Chairman. Thank you, Mr. Chairman Bolso. Now, kindly explain to us the reason we need to extend it from 2 to 3 years and why not 4 or 5 years? What is the reasoning for this?
Thank you, Mr. Chairman. Well, the reason is that I think it's important to protect the interests of a surviving spouse as much as we can, because that actually protects the interests of the family. And I would not be opposed, frankly, to extending it beyond 3 years to 4 or to 5. But this seemed to be a good first step in order to extend the protection to the surviving spouse.
You're recognized.
And, well, thank you for that. Also, kindly tell us this, in the previous amendments, this definition of the personhood, is that still contained in this bill or not anymore?
Thank you, Mr. Chairman. No, Chairman Kumar, that part of the bill has been amended out and is no longer part of the bill. This bill does just one thing, and it's what I've described.
Okay. Thank you. Thank you, Mr. Chairman.
Thank you. And to follow up to that, that was a question that was asked in subcommittee, just to get on the record that you were not going to amend or accept an amendment to put that back in. Is that correct?
Correct.
All right, thank you. Chairman White?
Thank you. Now, I may have missed it in your opening comments. What is the current law now?
The current law says that a rebuttable presumption arises after the spouses have been apart for 2 years, that the surviving spouse has, quote, willfully withdrawn from the marriage and could be deprived of the opportunity to bring the wrongful death action or to participate in the recovery of proceeds.
Thank you.
All right, any further questions for the sponsor? Seeing none, will the clerk open the board for a vote? All those in favor, vote aye. Opposed, vote no. All right, clerk, can you please take the vote?
Mr. Chairman, you have 17 ayes and 4 nays.
House Bill 1528 passes and moves on to judiciary as amended. Thank you. And that brings us to item number 4, House Bill 1844 by Representative Butler. You have a motion and a second. You are recognized, and I believe you have an amendment for the bill.
Thank you, Mr. Chairman. That is correct. Amendment drafting code 013053.
Head draft code 013053. Can I get a motion? You have a motion second. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. I've carried legislation in the past on safe haven legislation, and what this does is clarifies some language in multiple sections of the codes on the locations that you can have. It changes a little bit of the language for staffed 24 hours a day to scheduled to be staffed. And I'll get into a little bit more of that later, and cleans up some of that to address some of the concerns that some of our county and city attorneys have had. And so what we've done in the amendment is require 24-hour monitoring on safe haven baby boxes, which is already done by Safe Haven. They already require that. All of our boxes are tested for 7 days before they're put into service. And so that wasn't that concern was addressed by making that to be monitored. I know, Mr. Chairman, that you brought up some concerns in subcommittee about response times. And so I do want to address that. I made the phone calls and checking on response times. And I see Chairman Williams sitting over here. I talked to his fire chief, Benton Young, and their response time in the city of Cookeville is 5 minutes and 18 seconds. So that's a city response time. In Livingston, not that there's a competition, but it was about 4 minutes and 15 seconds, smaller city, of course. So easier to respond, multiple fire departments in the city of Cookeville. And I talked to the EMS, and those response times are very similar to what the fire department's response time. So to address your concern about response times, it's probably going to be 5 minutes is just a little over, a little under. If in fact the fire department was the person to respond back to their own station, and in discussing some of that with one of the other fire chiefs, we have administrative staff that is there, even if all the firemen have been dispatched. There's administrative staff that in many cases is still there. So the likelihood of a station or someplace not having anybody there at all would be extremely rare. If in the case there wasn't, we would have an average response time of somewhere between 4 and 5 minutes for those firemen to return back to that station if law enforcement or some other agency didn't get there first. So I did want to address that, Mr. Chairman. You had expressed that concern in subcommittee and want to make sure I address that. And with that, I'll stand for any questions.
Appreciate you putting that on the record. Representative Gillespie.
Thank you, Mr. Chair. And I'm sorry, because you were just kind of talking about this, but since we're opening it up to places that are not mandatorily manned 24 hours a day, what is the, like, if this passes and, you know, just pick a fire station that is not manned, how does the mechanism work? Is it like a 911 call that's automatically generated by the box? Like, just what, because I'm not familiar.
You recognize.
Thank you, Mr. Chairman. Excellent question. So it doesn't add any additional locations. The locations were actually in the sections of code were listed here, and then they were repeated down in the lower section, and some of those locations were not duplicated in the lower section, so it corrects that. And so the way the Safe Haven box works is currently they are connected to the 911 center. And three notifications go out when that box is closed after that child has been placed in it. One of those is a local alarm, goes off wherever the box is located. The second one is it calls 911 and says, hey, this baby box has been activated. And the third call is determined by the local authority. It can be directed to a fire chief's radio or another designee in the county or the city that this box is located. So we're making sure that people are being notified, hey, this box has been closed with a baby inside of it. Now, these boxes are heated, they're monitored. This is not just leaving a child in some random location. This has been very carefully monitored. And with that, Mr. Chairman, I'll
Thank you.
answer your question.
Chairman White.
Is there any responsibility or liability on the person surrendering the infant that's in the legislation also, as far as how their actions move forward as far as surrendering an infant?
You recognize.
Mr. Chair, thank you. Thank you. It's a great question. So in the law that was originally passed under the Safe Haven law, a mother or potentially a father, be rare, can surrender that child. And if that child is unharmed, she can return and retrieve that child, no questions asked, as long as the child is unharmed. Rarely does the mother ever come back. There is a small percentage where the mother does return. And the law further expunges on what happens if that child is surrendered and let's say a fireman recovers it, then he or she has got to take it to the emergency room where the baby's checked out by a doctor, and then custody is then turned over to DCS, and then DCS has families on a waiting list, especially for a baby, to take that baby in foster care.
Thank you.
All right. Any further questions for the sponsor? Chairman Clemens, you recognize.
Thank you, Mr. Chairman. I had a question about how we landed on these facilities, specifically the Emergency Management Communications Center or the nursing home.
You recognize.
Thank you, Mr. Chairman. Well, we had a very handsome legislator in a previous session. I believe his name was Representative Butler, that proposed those additional locations.
Objection.
Due to rural counties, which I represent, not having a location to put those baby boxes. And so the nursing home is allowed in counties that do not have hospitals, which there's about 20 of those counties. And then I will add that I have 2 counties that have had baby boxes at the 911 centers because that was the only location that met the requirements under the current statute. So if a baby is at a 911 center, they're staffed 24 hours a day. So there's somebody always in there, multiple dispatchers in most cases. To answer your question, Representative.
Chairman Clemens.
Thank you, Mr. Chairman. That's all.
Okay. Any further questions for the sponsor? Seeing none, will the clerk please open the board for a vote? All those in favor vote aye, opposed vote no. All right, will the clerk please take the vote?
Mr. Chairman, you have 22 ayes, 0 nays.
All right. House Bill 1844 passes and moves on to Finance, Ways and Means as amended.
Thank you, Chairman and committee.
All right, and one last bit of housekeeping. Next week, we will not be having the committee next week due to the budget hearings. And so seeing no further business before us, we are adjourned.